President Trump's massive tax and funding bill, known as the One Big Beautiful Bill, was passed into law last summer. And according to the nonpartisan Congressional Budget Office, it will slash more than $1 trillion in federal spending from Medicaid and the Children's Health Insurance Program by 2034. Senior correspondent Judy Woodruff examines what those cuts could mean for home and community care providers who serve adults with special needs. It's part of her ongoing series, Disability Reframed.
Franny!
Siddiqui Kamara's mornings are often filled with fist bumps and high fives.
So what's the plan for today?
He's the president of Bright Center, a day program for special needs adults in Manassas, Virginia.
So this is our main sanctuary. This is where, we do a lot of our activities.
5 days a week, the center provides education and a host of activities for participants like exercise class, arts and crafts, and meditation. In 2014, Kamara started the center with his wife, Naomi, who was born with sickle cell anemia. At the time, she told him she'd always dreamed of creating a center like this.
So when she came to me with that idea, at first I was like, why do you want to do that? but then, after her explaining that to me, it's her passion. She wants to help. She wants to give back to the community. She wants to make a difference.
Kamara says by 2021, he was working 3 jobs to help that vision become a reality. And Bright Center moved to a larger building so they could help more special needs adults. But then his wife's condition took a turn for the worse.
June 3rd was like the worst day of my life. The worst phone call of my life. Even to this day, I can picture it.
His wife's doctor had called to tell him that she had died unexpectedly while in the hospital, leaving Kamara with 2 young children.
I wasn't even able to function for at least a month and a half because I didn't even know what to do because it's like, she was everything, and I'm kind of like, I can't do this without her. You got 10 plus 8 minus 5, what is that?
But today, more than 4 years later, Kamara says he is still committed to keeping his late wife's dream alive for people like Imani Bush, who has an intellectual disability.
What kinds of things do you do when you're here?
What kinds of things? Well, I like to color. I like to do meditation. I like to sleep during meditation. I like to watch movies. And I like to just hang out with all my friends.
In 2020, Bright Center was serving nearly 30 special needs adults. But once the pandemic hit and forced Kamara to close for about 4 months,
good job, Francisco.
He says it's been a steady decline in enrollment. Today, just 14 individuals regularly attend. All of them pay with Virginia Medicaid waivers, which allow for care outside of institutions. And while the bulk of the cuts to Medicaid aren't expected to kick in until next year, states, which administer the federal funds, are bracing to lose more than $900 billion over the next decade.
This is the single biggest rollback in federal support for health care that we've ever seen. And people with disabilities are much more likely to rely on programs like Medicaid than people without disabilities. Even though the bill did not directly cut their services, it's highly unlikely that there won't be some effects.
Alice Burns studies Medicaid and the uninsured for KFF, an independent health research group. She says Virginia is expected to lose nearly 20% of its federal Medicaid funding by 2034, and that day programs like Bright Center could be especially vulnerable.
With this level of a funding cut, states are going to have to make some tough choices about how to deal with the loss of federal funds. And we know that home and community care for people with disabilities is a significant source of Medicaid funding, and almost all the services are optional for states to cover.
There's no cuts to Medicaid. There are simply restrictions in the growth of Medicaid over the next decade.
The Trump administration has repeatedly said there would be no cuts to Medicaid and that it's committed to rooting out waste, fraud, and abuse in the program. The Department of Health and Human Services also provided the NewsHour with this statement, which reads in part, "The One Big Beautiful Bill removes, quote, illegal immigrants from eligibility, implements work requirements for able-bodied adults, and safeguards Medicaid for the vulnerable populations it was created to serve: pregnant women, children, low-income seniors, people with disabilities, and struggling families. But Lori Sills is worried about what those changes will mean for her 28-year-old son, Nicholas.
Quite frankly, Nicholas, he's a wonderful kid, he really is. But he needs some support in just about everything he does.
As a young boy, Nicholas was diagnosed with cerebral palsy and then autism. He's been coming to Bright Center since 2019.
He's here with people his own age. He's here with people that he is involved with. He's got staff that cares for him, and he loves the staff here. So it's a place that I know that he's comfortable coming to and that I'm comfortable bringing him to every day. So it means a lot to me. Can you scoot over a little bit more?
Sills says Bright Center is the only nearby day program that accepts the Virginia Medicaid waiver she relies on to pay for these services. And without the center, she'd be forced, she says, to shoulder even more of her son's round-the-clock care.
He is never left alone. He likes to go into the kitchen and he'll press buttons. He'll go to the stove. I don't, in general, have babysitters. I don't have any family in the area. So I really don't have any other care for him but me right now.
I think you were one there.
It's a common story for parents at Bright Center, says Siddiqui Kamara.
Once they graduate from high school, it's kind of like the state kind of just washes their hands. It's kind of like you're on your own now. So that's where we come in.
Virginia's Medicaid program currently reimburses Bright Center $69 per student per day. But Kamara says that's barely enough to keep going. And while he's already relying on donations and his own savings to stay open, it's what could come next that worries him most.
We're at a moment now where the federal government is making some changes.
Right.
How is that affecting what your outlook is?
It will affect a lot of the families, and it would affect us as a facility, because then we may end up losing the small students that we have now.
For parents like Lori Sills, she's already feeling the impact of budget cuts. She says last fall, the state reduced the number of hours she'll be reimbursed as her son's primary caregiver going forward.
I'm sure there is some waste, fraud, and abuse. I'm sure there is throughout the system. But every case is not waste, fraud, and abuse. Some individuals really need the care. And quite frankly, that's my son that really does need the care.
Care that could become even harder to find for so many families across the country. For the PBS NewsHour, I'm Judy Woodruff in Manassas, Virginia.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.